The Gauteng healthcare workers say they're not only disappointed, but they're also really anxious after the rollout of the AstraZeneca vaccine was placed on hold on Sunday. Health Minister Dr. eNCA says data shows the vaccine isn't effective in preventing mild to moderate illness from the variant dominant here in South Africa. 1 million doses of the vaccine, of course, arrived last week. Masego Rahlaga spoke to some nurses.
As a frontline in the fight against COVID-19, health workers were supposed to start receiving jabs from Wednesday, but this is not to be. They say they are on edge about being the first in line, especially after Sunday's announcement.
As a health worker, my worry is too much on the money that is being wasted when making mistakes on this vaccine. Is the money that was supposed to go on the public purse and pay us and to show token on us.
We found out about this new variant before those vaccines were sent over to South Africa. It's not like we found out about the new variant here in South Africa when the vaccine was already here. Before it was shipped over, the order may have been placed pre-hand, yes. We don't know what happened, but they were supposed to put a stop to the shipment and ask for retesting to be done to make sure that this vaccine really will be effective for the variant that is in South Africa. Otherwise, what is the point of purchasing something that is not going to help the nation? And we, the frontline workers, are expected to even be at the forefront and get this vaccine first. I mean, how are we going to even be able to advocate for this vaccine to our patients? Because every day they walk in, they ask, so what is your take on the vaccine? And you find yourself not even being able to give my patients a confident answer and reassure them that there is hope, because even I don't have hope.
Unions say they are trying to alleviate fears among their members.
The question we are asking is, who is going to be rolling out this vaccine? Because we are always complaining about the gross shortage of staff, and the information in particular was not coming forth. That is why we were posing such critical questions. And again, we needed to make it clear to people that we are not anti-vaccine.
We call for calm to South Africans and call the government to do a proper thing of educating our people properly, and not to make announcements that create anxiety and confusion amongst our society.
The 1 million doses that landed at the OR Tambo International Airport last week are expected to expire in April, while the Johnson & Johnson vaccine is expected to arrive sometime this month. Masego Rahlaga, Johannesburg.